Improving symptom management in terminally ill patients, an evidence-based improvement and implementation plan for the acute care setting. Registered nurses in the acute care settings provide care to patients and their families from birth to death. 82% of patients with a terminal condition were hospitalized at least once in the final year of life for symptoms that caused them distress either at home or in an environment less equipped to manage their discomforts. Quality of care at end of life is a right to all patients regardless of the care setting. In this environment, nurses are expected to provide the highest quality of care at end of life to patients and families. Patients with symptoms related to terminal disease experience poor outcomes in the acute care setting in the form of frequent hospitalizations from poorly managed symptoms, unclear communication with health providers in the inpatient setting, and care that misaligns with patients' goals. Patients with terminal disease symptoms experience ineffective symptom management in the hospital. This contributes to feelings of depression, hopelessness, insecurity, loss of appetite, and insomnia. Surviving family members of patients who died while in acute care or soon after discharge from the acute care setting reported feeling unprepared for their loved one's death and identified lack of and misinformation from acute care providers. The patient's quality of life and satisfaction with care delivered in acute care depends on the initiation of end-of-life conversations and receiving information to support their decision-making. A lack thereof equates to poor quality of life. In the acute care setting, medicine goals are to cure, and symptoms such as pain are normal expectation of the healing process. Medical practitioners in the hospital are obligated to provide health information that allows patients and families to make informed decisions. These plans for end-of-life care should be discussed with patients and families when medical management of chronic or terminal diseases are becoming complex or the patient is demonstrating signs of functional decline. Nurses in acute care experience discomfort and conflicting feelings when caring for patients at end of life. Inconsistent and insufficient teaching on end of life is a hindrance to the delivery of patient-centered care at end of life and acute care. The existing body of literature on end-of-life care and acute care indicates that patients experience poor outcomes when end-of-life discussions and care planning occur late. Patients who present to the acute care near end of life have complex health needs which require lengthy hospitalizations and costly medical management. In a quantitative study on acute care hospitalizations near end of life in patients with cancer, it was found that 25% visited the emergency room more than 2 times in the last 7 days of life, and 32% have been admitted to an inpatient unit twice in the past month of life. In a study of the impact of professional development, it was found that continuing education on end of life improved practicing nurses' ability to deliver care. Nurses are prepared to care for patients across the lifespan through undergraduate programs and professional development. In undergraduate education, content on end of life is missing, insufficient, and inconsistently included. This contributes to varied preparation for end-of-life care in nurses entering practice for the first time. Nurses play a unique role in educating families on the disease processes, advanced care planning, and care options before death occurs. It is important for nurses in the acute care setting who establish a relationship with the patient and family early on to be able to educate patients and families on the options for care, disease progression, and symptom management during the end of life. In a quantitative study on treatment preferences near the end of life, it was found that 80% of patients with a terminal diagnosis desire and pursue comfort measures to control their symptoms. As healthcare professionals, our own beliefs about death and dying can be a hindrance to quality and patient, family-centered care. Nurses are lifelong learners. In healthcare settings, nurses typically participate in organizational instituted training annually and as needed. Also known as professional development, ongoing education keeps nursing practice current and ensures that patients receive care that is based on recent evidence. Given the limited and inconsistent inclusion of end-of-life content in undergraduate settings, where nurses are prepared to deliver care across the lifespan, professional development on this area is essential to improving the outcomes and professional confidence. By creating professional development opportunities for nurses to learn about end of life and the patient and family needs during this time, we are making a positive contribution toward their confidence in this area of health. Having the knowledge makes nurses feel confident, which in turn improves how they care for patients. Unique to the patients they care for, nurses have different perspectives on death and dying. The intended professional development program was developed by the End of Life Care Consortium and includes opportunities to participate in open discussion, hearing the perspectives of others, and sharing their own feelings about this seldom discussed topic, death and dying. Nurses are expected to care for patients from birth to death. Given the research, poor outcomes and experiences that patients with terminal disease-related symptoms equates to a lack of understanding the professional nurse's role when caring for these patients. A thorough review of the literature that pertains to improving nurses' knowledge of end-of-life care through professional development has revealed similarities and differences that make the End-of-Life Care Consortium program ideal for this setting. In studies that implemented this program in acute care settings, nurses demonstrated an improvement in understanding end-of-life care, how to advocate for patient needs, and deliver goal-centered care based on comfort. The End-of-Life Care Consortium program was intended to prepare nurses in a clinical and academic setting about end of life, so that they could teach others. To date, over 500 healthcare professionals in academia and clinical specialties have participated in the program. It is estimated that these individuals have in turn shared this information with more than 30,000 colleagues around the world. When it comes to teaching nurses about end-of-life care, the End-of-Life Consortium project has been used by more nurses than any other discipline. Studies have concluded that this program is the preferred method to teach nurses about end-of-life care. The End-of-Life Consortium project has been used to educate physicians, respiratory therapists, speech therapists, and other professional and ancillary disciplines on the needs of patients and their families at end of life. As with the findings in nursing, studies have concluded that this program shows promise in improving the knowledge of disciplines on end-of-life care. The End-of-Life Consortium project has been adapted to present to the public, patients, and families, making them aware of the changes that happen at end of life, both physically and emotionally. Given the consistency and positive learning outcomes the End-of-Life Care Consortium has demonstrated in nurses, other disciplines, and the public, I feel this is the solution to improving how our nurses provide care to patients with symptoms related to terminal diseases. So why would we recommend a professional development program on end-of-life care? We know that nurses enter practice with limited knowledge of end-of-life care. We know that professional development is well known and routinely participated in by nurses. We know that competence or knowledge is necessary in order to practice with confidence. We know that our own beliefs about certain topics strongly influence the way we behave. The End-of-Life Care Consortium program is web-based. Nurses are accustomed to using this and similar types of technology in practice. The electronic medical record has been around for many years and requires that nurses navigate different menus and tabs to gather and document patient information. In a similar way, technology can be useful in teaching nurses about end of life. First, it offers the flexibility of being able to accommodate the different schedules that our nurses have. Second, it promotes independent learning, which nurses as professionals need to assume responsibility for. To the contrary, technology comes with its own downfalls. For starters, it can sometimes be unreliable. In recognizing the introduction of technology in many social and professional aspects, there are individuals, particularly in those that are older, that may be overwhelming or difficult to grasp. Fortunately, this is not the case with the End-of-Life Care Consortium program. It is user-friendly and, as previously stated, its web-based presence will allow us to offer additional opportunities for nurses to view and engage with the concepts in ways that are meaningful to them. Our environment is equipped to integrate the End-of-Life Care Consortium program. It's web-based and will integrate fully with the technology that we currently have in place. This program is comprehensive and will address all aspects of nursing care that pertain to end of life. Our goal is to improve the experience that patients have in this setting when it comes to satisfaction with symptom management. Given the topics in this program, its content is relevant to our goals. The End-of-Life Care Consortium program is nationally recognized and recommended to improve nursing knowledge of end-of-life care. The End-of-Life Care Consortium program is not only recommended for nurses, but other healthcare professionals as well. I will adapt the content to include scenarios that have actually happened and therefore been experiences by nurses in this environment. I will develop a training plan that ensures all of the hospital nurses participate. This will include having several trainings available during different shifts. I will develop a plan to include annual review of topics that pertain to end of life so nurses remain competent on the subject. To maximize the experience nurses have when and from participating in this program, I will elicit their feedback and consider their perspective when improving future presentations and learning activities. When implementing this program, I would like to present costs, training schedule, and technical difficulties as barriers to anticipate. The annual cost for end-of-life care and acute care exceeds $32 billion. By educating nurses on end-of-life care symptom management, the suggested program will also educate them on programs such as hospice and palliative care, which when initiated early have been shown to reduce this cost. There are 839 nurses currently employed by this hospital. In order to effectively provide the intended training to all nurses, I recommend utilizing a trial approach. In this hospital, the majority of patients with symptoms from an end-of-life condition are cared for in the medical intensive care. I recommend that training be planned for this unit first. Thereafter, we can review the admission records to create the remaining training schedule. With most forms of technology, technical difficulties can be anticipated. As part of the implementation plan, I recommend that we reach out to the implementation department of the ELNEC to confirm that the program is compatible with existing software and networking equipment. Ethics plays a role in many of the situations and circumstances we encounter when providing care, especially at end of life. They help us to make decisions, whether they align with our personal beliefs or not. There is limited discussion about death and dying in American families, making the topic uncomfortable to initiate by healthcare providers. From the execution standpoint, the learning environment will have to be made comfortable so that nurses will feel comfortable discussing their feelings and perceptions about death and dying. In implementing a program to educate nurses on end-of-life care, it will be important to consider the common cultural beliefs held by the various groups in the area. This includes social status, for example. Homeless people have varying levels of education, and from an ethical standpoint, it is important to make sure the nurse understands how to advocate for them so they receive information from the physician or other members of the healthcare team in a way that allows them to make an informed decision. Patients with symptoms from a terminal disease present to the acute care setting for a number of reasons at increasing rates, and a large percentage of them will die there. The solution to this problem is to educate nurses on end-of-life care. Research supports professional development to improve acute care nurses' understanding of end-of-life, the patient and family needs, and their own beliefs about death and dying. Technology has become an integrated tool in education and healthcare practice. This tool has been proven through research to be an effective means to continuing education for healthcare professionals. With appropriate planning and support from leadership, a web-based program on end-of-life care can be applied to this setting. Much less a challenge, I anticipate a collaborative approach to determining which content from the multidisciplinary program will be relevant to nursing and nurses in this setting. Based on the research, both in educating nurses on end-of-life care and patient-family experience in environments whose nurses have received training on end-of-life care, this organization stands to benefit in the aspects of improved nursing competence, improved patient satisfaction, and reduced costs related to repeated admissions and increased length of stay.